Welcome and thank you so much for taking the time to attend this webinar. Next slide, please. Great. So just a reminder to everyone, there's a chat box on the right-hand side of your screen. Please put any questions into the chat. Keep your cameras off so that we can preserve the internet's connection. If you can stay off the microphone unless you're invited to speak, and there will be an opportunity for that, that will just help us move along as swiftly as we can. We'll preserve some time at the end for your questions. And if there's anything really pertinent, we will try and pick that up in the chat box during our discussion. Thank you so much. Oh, as you can see, we're recording this and we will share these slides afterwards. Great. So we've booked in 90 minutes. It may take 90 minutes. We may be quicker than that. Let's see. To introduce you to this Nigeria call for proposals for health financing. You can see here everything that we want to try and cover, and as I said, we'll try and cover it as swiftly as we can. Thank you. So here's the team that will be supporting this call for proposals at Mannion Daniels. Most of these people will speak today during the presentation, so please, feel familiar with them as they will be your focal points. So first, I wanted to talk to you a bit about Mannion Daniels. Mannion Daniels is in consortium with Oxford Policy Management as the chosen fund manager for Gavi, for a CSO, civil society organisation projects to support vaccination of zero-dose and under-immunised children. Mannion Daniels has had extensive experience as a fund manager with various different donors. And we have offices around the world. And through this current fund management role for Gavi, we're, I think, currently live in 14 different countries, and Nigeria is one of them. Thank you. So the fund manager mechanism that we are running for Gavi, as I've already said, aims to immunise zero-dose and under-immunised children in Gavi eligible countries. It's relatively new. We started working on this in 2024, and the idea is to try and reach is to use civil society organisations to reach communities that potentially the Ministry of Health may not be able to get to, or that last mile, to support the Ministry of Health to reach as many under-immunised and zero-dose children as possible. There's broad aims for this management mechanism. You can read them here. And depending on the country, there is a different focus sometimes on what we do per country. But these are the broad aims here. We have 3 priority areas that we ask civil society organisations to work in. You can see them here: demand generation, service delivery, and advocacy. And as you can see by the little stars here, actually in Nigeria, we're mainly focusing on service delivery and advocacy generally. You're probably aware that we recently launched a different call for proposals, which was based on the service delivery aspect of this work. That the call for proposals we're working on today is around health financing advocacy. So I'm going to hand over to Yakubu just to talk about the broader aims of this call for proposals. Yakubu.
Yes, thanks, Lizzie. Just to confirm, you can hear me specifically. Super, good. So, narrowing down to Nigeria, we are looking at this particular proposal has a highly targeted aim, and the aim is to specifically provide support to CSOs to advocate for health financing at the subnational level, specifically in 3 states. And we are looking at the following broad objectives to strengthen the state budgetary processes for immunization, improve state level financing mechanism, especially for the public sector, build state level advocacy capacity, enhance transparency and accountability, all at the state level, and to promote evidence based advocacy for immunization financing. We're not going to do this in isolation. The expectation is for the selected CSO to also coordinate with the national level and also coordinate with the service delivery partner in the selected state. And what we want specifically is to see how this selected CSO will translate advocacy into actual released domestic resource released specifically for immunization and PHC. And the current grant is focused on three states of Bayelsa, Sokoto, Zamfara. And the total grant amount is $262,000. Next slide.
Yeah, Cooper, can I just highlight on the previous slide? We're
Okay.
only looking for one grant to go to one organization. Thank you.
Yes. So, however, a sub-grantee or sub-awardee is also permissible at
That's
this
true.
point.
And that will come in a
Yes,
further slide. But yes, that's true.
yeah, exactly. So I will hand over to my colleague, Mabel. Is she in the call?
I think we might have missed it.
I think it's Sarah.
Okay.
Sorry,
Okay.
Rakia, have we missed some slides about CSO eligibility?
I think it's
Yes.
coming later. Is it?
Okay, okay.
Okay. However, I
Yeah.
think maybe I can just, before handing over to Sarah, we'll be talking about the eligibility if the slide is here. Otherwise, we need a national CSO in Nigeria that has office in Nigeria and has worked in the health financing space for PHC as well as immunization financing. And those that have worked on public uh, financial management, especially in the health sector. So, Mirabel or Sarah, which one?
I can
It's
speak to
Sarah.
theory of
Okay,
change.
Sarah. Okay.
Thank you very much, Hikubu. Great to be with you all. So as you can see on this slide, we have a theory of change for our work in Nigeria and a series of key performance indicators, KPIs, that we expect the grantee to use. So the grantee, of course, is expected to demonstrate how they are contributing to the overall aims and strategy of this envelope through the following indicative key performance indicators. So these KPIs will look at additional resources mobilized. So they might look at a 35 to 45% increase in state PHC and or an immunization budget allocations by the end of 2027. They also might look at the completeness of fund release. So we'd look for at least 80% of budgeted funds released within the financial year. They may also focus on capacity development. So here we would be talking about stakeholders trained on evidence-based immunization financing advocacy, legislative engagement. So this is about engaging with legislators and ensuring that they increase an allocation within their statutory mandate. Wider stakeholder engagement, so the grantee will be expected also to measure the number of stakeholders per state who are actively engaged in advocacy activities. And then finally, the availability of a scorecard or other similar metrics. So this would be a very simple indicator on the availability of a tool or data showing funding allocated to PHC and immunization and a percentage released and timeliness of releases. So these slides, as I say, will be available moving forward, but this just indicates the kind of measurement that we expect the successful grantee to deliver as part of their project. Let's move to the next slide and I'll pass back to Yakubu, I believe.
Yeah, so I think Susan, you have the mic.
This one's actually you, Yakubu. This one's about
Oh, okay,
eligible.
okay, okay.
Yeah,
All right.
can you see that one? Thank you.
Yes, yes, great. So we are looking at CSOs with that are registered in Nigeria with the Corporate Affairs Commission, and their headquarters also situated in Nigeria. The composition of the governing board must be or should be more of Nigeria, around 80%, to 20% other citizens. And we're looking at a senior leadership that is primarily above 50%, and they are also located in Nigeria. And one key thing is requirement is for the CSO to have a USD bank account to receive direct funding from Manion Daniels. We do not expect a broad consortium arrangement. However, if you have a sub-awardee that you can contract directly or specifically, that is encouraged. So, next slide. Okay, so what we expect that the organization or the selected applicant or the applicant, beyond being a CSO in Nigeria with office, we want to see the CSO demonstrate clear experience working at the subnational level, and that individual, the CSO should also demonstrate previous successful advocacy for health financing. Um, in terms of the quality of proposal that we want to see an alignment across the 5 strategic objectives in the call for proposal. We need to demonstrate clearly a realistic and measurable target, as the theory of change and the key performance indicators as enunciated within the call for proposals are clearly articulate. And we want the organization to also demonstrate how they will track progress uh, within this particular grant. Okay, so we have also shared the mail plan or the KPIs which we want the organization to also demonstrate in their proposal. Um, in terms of stakeholders engagement, we recognize there are multiple stakeholders within the state and also beyond, like at the national level. The CSO should also demonstrate clearly how they will be able to articulate or coordinate and support all the existing structures at both the federal as the state level to achieve results. Yeah. Okay. Next. Okay. So
Yeah, I can
hand
take this
over
one on.
to
That's okay.
Susan.
I can take this one. So
Okay.
um, as we've already said, we're looking for one grant to award to one applicant. As Yakubo said, we're happy for there to be sub-grantees, but we'll only be awarding one grant to one applicant. And we need you to apply using our online system called Grantelope. This is the only way that you are able to apply. We can't accept offline documentation, I'm afraid. First of all, you fill in a form that will tell you if you're eligible to apply or not, and that will mean that you don't have to spend lots and lots of time doing an application. It will just tell you immediately if you're eligible or not. If you're eligible, it'll let you go ahead with an application, and if you're not eligible, it'll let you know, and then you don't have to spend time doing an application that you're not eligible for. So once you're through, if you are eligible, you'll need to submit a project workbook, which is an Excel document, and our colleagues will talk you through that in today's session. We will also ask for a number of registration documents and background documents, and you'll need to submit that as part of your application, if you do not submit these documents, including audited accounts, you may be deemed ineligible. So please do make sure you include these. Once you've applied successfully, everything has been registered in Grantelope, then we get an independent technical review panel to score all applications against the criteria in the call for proposals. And that's how we come up with the shortlist of the organisation that we will choose. Thank you. So just a reminder of the deadlines, the call for proposals is already open and it will close on Thursday, the 14th of May at 1600 hours GMT. I've already mentioned that you need to use Grantelope to do this. We'll send you the information about Grantelope, I think, at the end of this talk. But please, we need to have an email address for your organization, and that email address cannot change. So we will be communicating with you via that email address. So please make sure that whoever puts their email address on the application, they're not someone who's going to leave your organization or isn't going on holiday for a long time, so that we can maintain contact with them. Please do not change that. I've already explained that you will fill in an eligibility form at the beginning of your process in Grantelope, and this will help you understand if you're eligible or not. Okay, we'll go to the next slide, please. A bit more about Grantelope. You are able to go into Grantelope, save your work and go back to it a different day and pick it back up. And it's saying here that a copy of the application questions can be downloaded from Grantelope so that you can read them offline as well. And we've already talked about the fact that we will need this workbook completing. That's an Excel workbook, and we'll talk about that in a moment. Oh, another point on that slide is just a reminder, as you know, with any online system, please don't leave it until the last day or the last minute to apply. Sometimes, you know, if your internet fails, you'll be in a difficult position. So please try and submit your application a day or two early if possible. Okay, so now we're going to walk you through the workbook, and I think my colleague Sarah is going to start that. Is that right, Sarah?
Yeah, absolutely. Thank you very much. So yes, we will just go step by step through the workbook that you're expected to submit as part of your application. My colleague Rakia is opening it up here. As you can see, it's an Excel template that has quite a few tabs. You can see at the bottom. The technical tabs, there are 5 of those and they are in blue. And then there are some guidance information at the beginning, and then subsequently some financial information. And you will be expected to complete everything that we run through today. So make sure that you do that. A good starting point is with the first tab. And in general, a good principle for completing this workbook is to complete everything in order, because the subsequent formulas read from previous information. Now, I'll give you some examples of this as we run through. So Rakia, could you take us first to that Read First Guidance tab? Thank you very much. So as you can see here, the first tab of the workbook is a guidance tab. Now, this provides some summary information as well as links to further guidance documents on the Gavi website. And if you scroll down, it also provides guidance on each tab. So please make sure you read this in full and familiarize yourself with the expectations before completing each tab. This will greatly help in the process of applying. So once you've read this information, progress to the Grant Information tab, which is the first of the application tabs that you'll need to fill out. You can see here that it's a simple tab. It comprises 2 tables. The top table is called Summary, and this is where you will add your organization name, as well as the proposed start and end date of your project. So Rakia, if you could add an example organization name, please. Fantastic. Okay, so you can see Rakia is adding an organization name. Yeah, if you could type something into that cell. Great, fantastic. Okay, and you can see then already the importance of completing everything in order, because below this table you have another table for your partners. Now, the grantee name pulls from the first table that you've just inputted into. So it's very important, complete that first table with your name, the start end date, project, country of implementation, which will be Nigeria, of course, and the primary contact name and email. But then moving forward, you'll start to see this information be pulled through into the other cells. So do bear that in mind. If you're proposing to work with any partners, please add them below. I think we have up to 10 rows for partners, for subgrantees. So make sure that that is fully complete per your project proposal. Let's move on now to the first of the technical tabs, the first blue tab, the workbook.
Sarah, just to add, grant reference is when you start your application on Grantalope, it will generate automatically a reference. That's what we mean here. So if you don't know it, just leave it. But if you do, please input the reference of the application you were given.
Fantastic. Thank you so much, Rakia, for the reminder. Yes, so do add that grant reference. Now, for the workbook builder, this is where you will start to build your technical proposal. And it's a little bit like a theory of change. So you'll see in this tab, you have, again, a series of instructions and different sections. And please make sure you complete everything in order because that helps with the logic. So first, familiarize yourself with the introduction text at the top of this workbook. Then, once familiar, you'll move on to the first section, the problem statement. Now, this is space for you to describe the problem that your project aims to address. And this really should be very short. Please keep it to a single sentence, be concise and be precise. We've given an example here. So a problem statement might be state budgetary and health financing processes need strengthening. Once you've got your problem, we have to think about what your solution is, what the goal is. And so that is where we move on to the project goal or the outcome. Again, keep it to a single sentence ideally. Focus on one main change, being as specific as possible, but also being realistic about what your project can achieve in the period. So here we've given another example. The project goal could be to strengthen state budgetary and health financing processes. And you can see how the problem statement feeds logically into the project goal. So let's move on to the next section, which is the participants. This is space for you to plan the different types of groups that you aim to work with. So again, these we've given various different examples. There's some examples in the introductory text, and there are examples also in the box on the right-hand side with the green headers. So really focus on specific groups, populations, rather than people. So we've given an example of legislators, health financing stakeholders, state health officials, and so on and so forth. You may want to work also at the lower levels, at the LGA level, and so on and so forth. So then you would add those different stakeholders as individual lines. And you can see we've got 7 individual lines below, just with participant group there. That is for you as applicants to propose who would be the most important and pertinent people to engage as part of your project. So feel free to add to these lines as is necessary. The next section is on project activities. Of course, once we have defined who we'll be working with, let's define what we'll be doing. And we've got 2 columns in this table. Again, take note of the introductory text. The first column is the activities. These are specifically the outputs, really, what you're going to be doing. as part of the project. And then on the other column, we've got assumptions. And this is about being clear why it is important to do these activities and what will make these activities successful. And it's really important to keep track of your assumptions, as this is what makes for a mature, well thought through and adaptable project. It shows really that you're kind of thinking about the project from all angles. So we've given some examples again. So on the row 1, we've given the example of stakeholder mapping sessions. So this might be something you do right at the beginning to have a clear picture of who your stakeholders are. And then mapping results, we're making the assumption, would be disseminated to decision makers. On row 2, we've given another example. Advocacy events were held with high-level stakeholders. But the assumption here is that the advocacy events are attended by the right stakeholders, by people who really have decision-making power. And so you can kind of see already how you might start to populate this table. So make sure that you've filled in this table with all of your activities. As I say, there are multiple different rows after these examples to complete. So you can see if we scroll down, I think we've got 10 or 15 rows of activities and assumptions. Do, of course, use as many as you would like to. It goes up to 20. Use as many as you would like to, and familiarize yourself first with all of the introductory material. Can we then move on right to the bottom, Rukia? And yes, and then we will look at the outputs or the changes that your organization aims to achieve. So we've already identified the issue. We've identified the overall goal of your project, who you're going to work with and how you're going to work. And now we have to specify what changes we expect from these activities. And again, we've got some examples here to support. So they could be, for example, strengthened health financing budget allocations and regular disbursements. They could be an engaged and proactive health financing stakeholder group, or it could be strengthened advocacy efforts to support health financing. So these are all examples for you to adapt based on what your project aims to do. And again, think really clearly about which activity or activities will contribute to this output. So on the right-hand side, you've got some examples here. So you might say, for example, for those strengthened health financing budget allocations, it's really going to be activities 1 and 5 that contribute, whereas for the engaged and proactive health financing stakeholder groups, it'll be more the activities you're doing in 2 and 6. So make sure it all aligns, you've mapped it out very thoroughly, and we can see your thinking throughout. And then finally, if we scroll right down to the bottom, you have again the project goal. And Rukia, can we just click onto the project goal, that cell? Fantastic, thank you very much. So you can see the project goal again appears, strengthening state budgetary and health financing processes. And if we click into that formula bar, we can see that it's pulling from E16. So again, just another simple example. Please fill this form in from left to right and from top to bottom. Make sure you do the first tabs first and then subsequent tabs afterwards, because everything pulls from previous information that you've fed in. So that's the workbook builder. That's a really foundational tab. We'll move on to the results framework. Now, the results framework, I hope you're all familiar with. This is a very simple data tracking tool. On the left-hand side, you've got a column with outputs. So you'll see down here that the outputs you have inputted into the workbook builder appear in this table. And then next, you've got a column with output weighting. So we would expect these indicators to add up to 100, as you can see. And if they do not add up to 100, then make sure that you edit them so that they do. This indicates how important each indicator and overall the output is to your project. And then it's your opportunity to start to express those KPIs, those key performance indicators. So we've got a drop-down menu of standard performance indicators. Oh, excuse me, it looks like that's not working for now, but they appear also in this table here. Please feel free to make use of these standard KPIs. We are looking for grantees who show a clear understanding and approach to the KPIs. But of course, as we've added in an example below, you can also include a self-defined indicator in row 13. So there's the opportunity to both mix and match with your standard indicators and your self-defined indicators. Once you've defined your indicators and you're happy with the weighting, move on to the baseline. Now, this column is about adding any existing data for the previous project period. So that would be for example, if it's a 12-month project, that would be the 12 months before the start of the project. And this gives context to the targets that you're about to set for each indicator. So for example, if we have a 50% of budgeted funds that are released within the financial year as your baseline, then you have a good rationale to start setting targets at 55%, 60%, 70%, and so on and so forth. So that really grounds what you're about to propose in your targets. So make sure you complete column J, your baseline. And then moving forward, you see that you have columns for your 6-month target and your actual result. Your 12-month target, so that is your unique target, which is just what you want to achieve in months 7 to 12. Your cumulative target, so it's what you want to achieve the whole project period. And then the same for your 18-month targets, so it's what you want to achieve in months 13 to 18. And then there will be a final column for your final target. And then very important at the end, column W is your means of verification. So for each indicator, we want to see a really clear, well thought through, distinct way of verifying each indicator. So for example, if you want to measure the number of stakeholders engaged, you might use means of verification that include attendance registers. They may also include pre and post polls. You might want to talk about the quality of engagement, the degree to which people have really taken on board the advice and the training you have given them. You might also add, for example, participant feedback as your means of verification. So we want them to be very, very specific, not just a list of names, but specificities around how, when, and the quality of this engagement, and so on and so forth. You can also, of course, use government data sources for your means of verification, such as where relevant DHAS2 or WUNIC estimates. Can we move on now to the work plan, Rakia? Thank you. So the work plan, very quickly, is another of these technical tabs. It's a simple table with your activities on the left in column C. So again, these pull from the workbook builder, so please fill in the workbook builder first before you come to the work plan. And then what you have along the rows 5 and 6 at the top are the months and the dates of these months for your project. So add in the specific dates that you're going to be delivering your project, and then it acts as then a simple Gantt chart. Mark against each activity which months you expect to deliver this activity in. Key here, make sure all of your activities are marked up, that you have a clear date, clear start and end date for these activities. Make sure that every month for your project is represented here, so just make sure that your dates are fully representative. We have included plenty of columns for you, so you can add as many or as few months as is necessary. And then,
Sarah, could I just interject slightly?
Mhm.
So this is another really good example of how this workbook is put together. So the dates are actually linked to the grant information that you input on the very first tab. So if you click on, Rick here, can you click on grant information tab? Next one, that's it. If you put the start date as, say, the 30th of, or 1st of July 2026, and then the end date can be anything, what, 6 months, just any end date. Okay, and if we go back to that work plan, you can see the dates have automatically populated for the duration that you have stated.
Fantastic. Excel magic. Thank you very much.
Absolutely.
Thank you. Yes, exactly. So do fill in every single cell as prompted right from the beginning of the workbook, and you'll find this is much easier to fill in. Let's move now to the risk register. This is a really important tab. We don't expect any project to be risk-free. That's simply not how projects work. But what we do need to see from successful projects is a mature and explicit response to risks. So something that really considers risks from all angles and has a plan to deal with them as and when they arise. So what you've got here in this table is on the left-hand side a column for your date. So please add the date when you initially identify the risk. Then we have a column C on the type of risk. Now, if we click into this, you'll see that it's a drop-down menu with all sorts of different types of risks: safeguarding, context, operational, programmatic, and so on and so forth. Select the risk type that best fits the risk you've identified. Then in the next column, it's the status of the risk. Now, we would expect every risk you raise at the application stage to be open, because what you are indicating is that it will be a risk when the project starts. But there are other options, such as during project implementation, if something is no longer a risk, it may become closed, for example. Or indeed, it may have changed. It may be a new risk. So do make sure you're familiar with the status column there. Fantastic. Thank you very much. Then you'll have to add a description of the risk. So we've given some examples here. So the one is to do with school closures due to flooding. And then you will identify how probable the risk is. How likely is it that this will actually become a real issue for the project? And here again, you've got a drop-down list and you've got a range of different options. They range from likely, so most likely to happen, moderate, so it's potentially likely to happen, but less likely, and unlikely to happen. So it might be a really high risk, but it may not be very probable that it'll happen. Then we ask you to explain the impact that this risk might pose to your project. So think about what happens if the risk really becomes an issue for you. And again, we've given examples. Please read through these examples. They will give you a guide of what we expect. And then in the subsequent column, there is a drop-down list on the risk magnitude. So how much of an impact would this risk have? So that goes from low to high. If there's a really high risk, it might really kind of prevent you from delivering core activities. If it's a low risk, perhaps it's something that it will pose some minor delays, but nothing more. And then finally, super important, again, we just want to see projects that think through very clearly the actions that they'll take to mitigate risk. We're not expecting to see projects that are risk-free. And in fact, a project or an applicant that does not fill in the risk register fully indicates to us that they're not prepared to engage with the risks. So do make sure that you fill in that final column on the action. And then finally, the final technical tab is the learning tab. So here we really want to learn and share with our grantees. And we've got a large portfolio of grantees now, so the successful applicant will join them. And this is their opportunity to generate and disseminate lessons learned about the project. So in this table, we've got a column on learning question. We prompt all applicants to provide 3 learning questions. And again, we've given an example. Then in the next column, please give 1 or 2 concrete examples of how you will use and disseminate the learning. So it might be a learning brief. It might be a presentation to key stakeholders. It might be something else. It might be an infographic, and so on and so forth. And then live grants complete the remainder of that table with the updates on lessons learned per quarter. And that is the technical element of the workbook. I'll pass over now to Sue for the budget.
Hello, everybody. So now you've built your project, you've identified your activities. Now's the time to start putting some costs against those activities. Now, this budget has been put together and should be completed, as with everything else, from left to right and from top to bottom. So in the first column for column B, we can see the cost groupings, and these are all linked to drop-down boxes. So the first section is the category of lists of costs, and these are Gavi standard categories. So you would select one of these categories. Let's select, say, human resources, category 1, and then you can move across to the next column, column C, which is a cost input. Again, these are drop downs, and they are the Gavi standard drop downs. If you want to click on those, in here you will have all the cost inputs that are linked purely to the HR or the human resources. So let's put in anything, a specialist or a manager. Okay. Now, with your activities, everything you've identified in your workbook builder will be listed on this drop down, and you should be assigning costs to all your activities. Now, we appreciate that some costs can't be tracked to a single activity. So, for instance, generally your staffing costs, your staff will work across all the activities that are being performed. Those can be charged to what is said at the top, multiple activities. Okay, so when we move to the budget line, this is your chance for free typing. Please keep the description of what this cost is to be succinct. So this would be your manager. You could put salary on costs, 20% manager. Something very succinct, but is clear as to what these costs are going to be. Just put some gobbledygook in, Rikia, that'd be fine. That's it. That'll do. And then the partner, again, is a select. You can select from the drop-down box, and that would be linked to the input you have put on the very first tab. So if you identified new additional partners, subcontractors, they will be listed on here. Okay, I don't know if you want to do another line, Rikia, so that we can see the different cost groupings. Okay, there we go, as if by magic. Okay, do you want to scroll back to the beginning, Rikia? That's it. If you just put in the cost groupings, let's link that to, say, events, number 5. And as I say, when you come to this cost input line, this is where anything that's linked to an event, according to Gavi's classifications, will be here. So it's normally your events costs, your venue costs, your room hire, subsistence, materials, or it will be per diems, people transporting, refunds for transport, accommodation costs. Now, this is where you should be linking to your activities. So you're going to have an event. Just want to click on the drop-down box here in the activities column and say we're going to do a stakeholder mapping exercise. And then you can put in for the room costs. Please try and be descriptive. So if you know you're going to have room costs, do one single line for your room costs for your mapping. Or if you're going to have multiple costs for this one event, please make sure you detail out in the notes. We'll scroll across. Thanks, Rakia. Okay, that's fine. Okay, moving across to the dates. Now this spreadsheet will automatically give you the dates available according to your project details. So we said it would start in July 2026. As you can see on the budget, your first quarter is quarter 3, which is the third quarter of the year. Then that would be the costs for July to September. So please phase the costs by quarter for where you expect the costs to be incurred, not when the event's planned, but when you're actually going to pay for the activities you're costing. And then the very final column is the budget notes, and this gives you free type to clearly describe in detail how this cost has arisen. So if you've got, say, $7,000 for an event, please be very descriptive of the unit cost for hiring your room, or the unit cost for your participants to travel, or your salary costs and on costs per month, the level of effort for your staff. You can have as many characters in this as you want. The more information you give us, the easier it's going to be for us to review and assess the value for money. And that's it for the budget.
Great, thank you very much. So that was the walkthrough. Sue, do you want to take these do's and don'ts for the workbook?
Yes. So as Sarah said, please include in your budget, include your M&E costs, because we expect you to be doing end-line evaluations, baselines. Make sure these are included in your budget, and your reporting costs, and also your direct administration costs. If this is going to extend over a year, don't forget about inflation, especially in country, and I'm thinking about the price of oil in particular at the moment, and also your salary costs. Do you give an annual increment on your salary? If so, build it into this budget. Now the costs, as we say, these should be in line with your work plan. So you're telling us when you're doing the activities, and we should be able to see that in your budget, when you're paying for those activities, we should be able to line up the budget with the work plan. You are allowed to have an indirect cost recovery, and this can be a maximum of 7% of all the other costs. That can just go in on one single line under administration. You will find the relevant drop-down boxes you need just to put it in, and it can say as a maximum of, absolute maximum of 7% of all the other costs. And plan for the end of the project, plan to do your M&E, your end-line evaluation, other costs that you need to incur. We've included links to guidance documents. Please read them. The finance guidance is there about thinking about exchange rates and thinking about good budget management. One thing to note as well, all payments are in US dollars. Your budget needs to be in US dollars. Please don't try and change the format of this template or any of the formula. And check the guidance to see which costs now are ineligible for Gavi funding. And those include the lobbying, gifts, capital, including vehicles now, and depreciation. You also need to record all your costs for any subgrantees on an individual line basis as yourselves. And don't include contingencies or provisions. All right, everything has to be clearly defined, given unit costs, and well described. Okay, next slide. I shall carry on. Okay, so once a successful grantee has been selected, we would be carrying out a really robust due diligence assessment on all the grantees. There's two sections for this. There's the organisational due diligence and the project due diligence. It's quite a lengthy assessment and it's very detailed, but actually the end result, the reports that come out of this are actually intended to be capacity strengthening exercises for you. We would be assessing, it's a point of time assessment. Don't start writing policies now if you don't have them. We want to understand the current state of the organisation, the current governance structure in place, and the internal controls you have. And we also need to understand how you intend to manage your partners. That's all done through my team online, and then we would also be having an on-site assessment, which is called the project due diligence. And Yakuba would be doing this. He would be visiting you on site to go through the project due diligence section. We expect this process to take between probably around 2 to 2.5 months, depending on how quickly the assessments come back to us and how quickly we can finish or resolve any issues that we have. But that's a good thing to think about when you're building your activities and your budget. I mean, the call for proposals ends in the, can't remember. And then we would do
14th
the technical.
of May.
Thank you, Lizzie. The 14th of May. It's quite quick. And then we would be doing the technical review. Once the selection then has to be approved by Gavi and EPI, and then we would be able to start the due diligence process, which is going to take another 2 months. So we wouldn't envisage these projects starting much before the 1st of July. That's really important to think about when you're setting your budget. Next slide, please. Okay, just to flag, there's an absolute zero tolerance for all fraud. Any fraud must be reported immediately to the fund manager, to us. We have extensive guidance. We do have a whistleblowing facility, and Gavi is very clear on the zero tolerance approach. If you do identify suspected or reported fraud, once it's reported to us, we will work with you to help you resolve the cases of frauds and satisfactorily going back to Gavi to get the case to be closed. Just to flag, you are responsible for any losses for fraud under this grant, and that includes to your partners. So you should be doing due diligence on your partners and making clear to them that they need to report any fraud. You will be responsible for your partner actions. And Gavi will not fund any funds that are lost to fraud. Okay, I'm going to pass back to Lizzie.
Yes, thank you. Hi, everyone. We launched the call for proposals on the 16th of April. I put the link to that call for proposals in the chat box. So hopefully you've all found that. It will close on the 14th of May. Sue has already explained that then a selected organisation will need to be approved by Gavi and by the NPHCDA. And then we will proceed with a due diligence, which can take 8 weeks, and that's highlighted in the blue box here on the screen. And then we hope that this grant will be able to commence around August for around 17 months until the end of December 2027. So just to recap, we've got one grant available for one CSO. But sub-grantees are welcome. This is to do with public health financing. We've been through the aims and objectives in this call. We're going to be covering 3 states that are listed here. We need you to submit any applications via Grantelope, our online system, before the 14th of May, and we encourage you to do it a couple of days early, at least not at the last minute, please. If you have any questions, we have an email address here where you can get replies to any questions. We're happy to take questions, kind of broad questions about the process or application process now after the end of these slides. But if you have a specific question to do with your organisation or a specific problem you're facing when you're logging into Grantelope, then please do send it to this email address and we will give you as much support as we can. Next slide, please. Okay, I see there's some questions in the chat box, but should we do the poll first? I think this is Sarah.
Yes, certainly I can run the poll. So you should.
I just launched it.
Oh, thank you, Ricky.
Sorry, Sarah. While we are doing the poll, could I flag something the independent review panel has flagged, which is the contradiction between the workbook and application. And maybe the reason is like you do the application online first, then you get to the workbook, then you'll have more detail and probably the latest information while you are discussing the detail with your teams. So the recommendation would be great if you can download the workbook as soon as you start the application and you pass the eligibility checks. Then you can do both in the same times, if in tandems, so you'll have consistency across both the application form and the workbook. That would be very helpful, and I think we will have the latest information, like for example, the same amount of budgets requested in both the workbook and application, the same project title, and all the same, for example, result aim to, that would be great.
Thank you, Rakia. So my apologies, I need to leave now for another meeting. So I'm going to leave you in the capable hands of Rakia to facilitate the questions that are in the chat box. And Sarah, just over to you to finish the poll and just explain what it is we require from everyone. But thank you. It was lovely to meet you, and I'll let you continue with questions. Thank you so much.
Thank you, Lizzie.
Thank you so much, Lizzie. Yeah, so we can see quite a few of you have responded, but there are some people that we're still waiting for a response from. So we would really welcome your feedback at this stage. Your feedback will be used to make these sessions more informative in future, and also will give us a guide on your thinking at this stage. So I will give everybody maybe half a minute more just to submit some feedback. It's 3 very simple questions. In the meantime, Rakia, shall we start to answer some of these questions in the chat?
Yes, please. Do you want me to read through?
Yes, please, if you're able.
Yeah, so one of the question is about eligibility test. So the organization had started the application, but they get the error notification, and they can't pass the eligibility test so far. Will be great. So the recommendation will be the way it's calculated based on the amount you have requested. The organization have to show like your financial capacity in managing that much money, and the way it's done is calculating the average expenditure of your organization during the last 3 years, and based on that, the formula will calculate will check if you are eligible to get that much money or not. In the guidance that is on Gavi, on the call for proposal, there is a calculation based on that. Please have a look and adjust your answers based on that. It will help. If not, you can always send us your request, your question via the email we provided, and we will make sure that our digital team, they will look into it and see exactly what's going on and provide like detailed answers based on your case. There is another question. So a question, does the projects involve mental health? Shall I leave it to you, Jacobo, to answer that?
Yeah, so no, this is all about immunization financing, not therapeutic or anything beyond increasing domestic resources for immunization or primary healthcare at the state level. For now, based on the three objectives of this Gavi CSO grant, is one, we focus more on immediate service delivery, demand generation, and ensure to reduce hesitancy so that eligible children can be vaccinated. And also we strengthen advocacy to increase domestic resources for immunization financing. Thank you.
The next one, probably, Jacobo, is for you as well. The question is, if you are in Nigeria and you are covering a community with this grant, if you are successful, can someone also extend to other community if the vaccination is remaining?
Yeah, so I think this particular question has been answered in the first impact grant, the service delivery grant. This particular work is focused mainly at the state level, where the legislators, those who are primarily responsible for both allocation, appropriation, and also expenditure or spending at the state level. It is beyond, I think the boundary is just within the state level. However, the impact grant that we launched last year, and I think that's the one that is responsible for increasing vaccination coverage. And as soon as the due diligence or project due diligence is completed and there's complete alignment with what the state priorities are, then that decision to move from one community to the other will be determined collectively with the state agencies. Over.
I think on the same line of question is the grant community by community or for a particular state in Nigeria, and I think we answered that because it's mainly in three states: Zamfara, Socorro, and Bayelsa. Another question, can applicants, including previous awardees, submit proposals under more than one funding mechanism cycle? Probably you are referring to the first Nigeria call for proposal that was service delivery focused. Jacobo, I'm looking at you. Could you take this?
Okay,
Sorry.
so long as you are a Nigerian CSO, you are eligible, irrespective of whether you applied for the first impact grant or not. We encourage Nigerian CSOs that met the eligibility criteria to apply. The doors are
Perfect.
not shut.
Thank you very much, Jacobo. I have another question for you, and this one I think it's easy. Can applicants apply to implement in all 3 states or just one?
Okay, so the grant amount covers all the 3 states. So the expectation is for each applicant to apply for the 3 states, not 1, not 2, but the 3 states.
Perfect. Thank you very much. There is a question, is there specific type of immunization involved, like HPV vaccine, or the applicant can work on any vaccine of choice? And I think we answered and we said this is mainly health financing focus grant. Is that a fair assumption, Jacobo?
Very fair.
Okay,
So
cool.
this is not service delivery. This is for state level advocacy to increase immunization financing, domestic immunization financing at the state level, which means budget. We want to see budget for routine immunization or PHC. If it doesn't exist, you support the government to create one. If it exists and it is suboptimal based on the analysis or evidence of expenditures, previous expenditure, it is not adequate, you discuss with the state government to increase it and to see that whatever is budgeted and or allocated or appropriated is expended or released for immunization activity. Thank
Thank you
you.
very much. Thank you. So I have another question. If a foundation is not located within these 3 states mentioned, can the organization still be eligible to apply? And I think we answered this question saying we want a Nigerian registered organization, not necessarily based in Zamfara or Sokoto or Bayelsa to be eligible to apply. Is that correct, Yakubu?
Yes.
Okay.
So if you are if you have worked in Borno or if you are working in Borno, you are eligible. If you are working in Osun State, you are eligible. So every Nigerian CSO, so long as you fit the definition of a CSO in Nigeria, you are eligible to apply for this grant.
Another question, can organization not centered on medical health but centered on mental health and drug abuse apply? And the answer is, as long as your grant is your grant or your application is focused on public financial financing, health financing, it would be okay to apply. Jacobo, is that okay?
Yes, if your organization is focused on mental health and you have demonstrated clearly in your previous project that you have increased allocation or you have supported the state to establish a budget line for mental health in a state, and you have worked with the legislators to also appropriate that particular budget line with enough money or funds, and you have worked on public financial management to support government through mental health or mental health as an entry point, you are eligible. But one core thing we are looking at is you have demonstrated clearly that you have supported a state or the national or at any level with to increase domestic resources for health.
Thank you very
Over.
much, Yakubu. Another question I have here, how can we send our application to the 3 states, and where do we find the link to apply? So Lizzie has posted earlier the link to Gavi website where you can find all the information, the guidance, but also the link to apply. I have just reposted now on the chat. Also, once by tomorrow, probably we will send you the PowerPoint presentation. We will send you all the links that's needed to apply. And we will send you the guidance as well, and the recording of this webinar, so you can refer to. The idea is not to apply to send the application to the 3 states, but during your application, the implementation, if you are successful, if you are selected, will be in this targeting this state. So you have to bear that in mind, but the application is not sent to these 3 states. The application will be done on our grant management system, which is we call Grantolope, and you have a link here. I can also you will be sent this link by tomorrow, but you have it also on the call for proposal. Thanks to the link I posted on the chat just now. Follow the steps. You'll have also the guidance on the call for proposal that is on through the link. Please read through the guidance, then follow the instruction and the link. I hope that answers all your questions. I don't see any further questions so far. As I said, this is recorded and we'll be sending you the material and the recording by tomorrow afternoon. And if you have any questions or concerns or technical issues, please share with us using this email. Is Gavi csos@manueldaniels.com. So if there is no further question, we can close end this webinar, and the best of luck for you all. And as I said, if you have any question, please share with us or contact Yakubu as well, and we will support you as much as we could. I have a question here. If organization is supporting, okay, another question. If organization is supporting pregnant women and nursing mothers with free healthcare on a private level, not government level, will they still be qualified? I am looking at you, Yakubu. This is a question for you.
So long as you are a organization working in Nigeria, you are registered as a not-for-profit and you are registered with the Corporate Affairs Commission in Nigeria, and you are working with private sector, the private sector, and you have done development work with the private sector, you are still eligible. The caveat will now be if you are able to demonstrate clearly you have supported the private sector to achieve increased domestic resource mobilization for the pregnant women you've highlighted or nursing mothers. Over.
I hope that helps you understand the mechanism of this call. As I said, if you have any question, please share with us, contact us. Best of luck, and thank you very much for joining the webinar today. And have a lovely afternoon. Thank you very much.
Thank you very much, everyone.